am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care. Today, I'd like to introduce Chris and Karina. Chris and Karina are the parents of James. James is a 2-year-old, and he was born with a rather impressive birthmark called a giant Nevi. Welcome.
Thank you for having us.
Tell me a little bit about this. Your child came out, and there was a birthmark, and what were your first thoughts about this?
I think there's some fear, not knowing what it was. When he was first born, we were happy that he's healthy, he's alive, he's crying. Yet we really thought when they were cleaning him, or at least I thought, that it would come off, the markings. And when they didn't, there was some fear, just not knowing what is this and what are the implications.
No one in the the operating room had any idea what it was. So it was actually a while before we found out.
And the operating room, because your baby was born by
cesarean
section. Okay.
Right.
And how long did it take before we had some idea of what kind of birthmark we had here?
Well, thankfully, the doctor that delivered James, he stayed. He was supposed to actually go off of his shift. He stayed an additional 4 or 5 hours and did research. And then the next day when we had James's pediatrician,
his other
pediatrician, that's true, from your office, arrived, that helped to reconfirm that they thought it was Nevi, giant congenital Nevi. But it actually took a few months till we had it officially diagnosed.
We didn't have it confirmed yet for quite a while, so there was still some question as to whether it might be NF1, because he was also born with the satellite Nevi that looked...
So there was a question whether we had something called neurofibromatosis or whether it was really a giant Nevi. And was it the dermatologist who finally made that determination?
Yes.
Okay. Yes. And you know, you have a new baby, you're all excited, family, friends are rushing in. How was that reaction? Did it seem awkward?
I think there was some initial shock and worry, again, because this condition is so extremely rare. But one uncle in particular, when he saw it, his first reaction was, oh, that's it? Just that? That's nothing. And that was a great relief. It was a reminder that things could be so much worse, and even though we had this fear mainly out of ignorance, it was nothing beyond that. He seemed to be a normal, happy, thriving baby.
We're very we're very reassured by the fact that he seemed otherwise very healthy. So that did help, and family did help with reassurance as well.
So we didn't have too much taking away from the fact that this is a really exciting thing. You have a new baby boy, and that's a big part of your life.
Exactly.
How about reactions when you went out in the world?
Well, thankfully, because of James's Nevi, it's on his chest, people don't view him differently, especially as a young baby. He's wearing clothes, and I think we were super cautious. He was born December, so we kept him in and really didn't take him out unless it was the doctor's visits. But normally, there's no reaction at all. But for kids who have a Nevi in other locations, their experience can be radically different.
It's very common to have it on the face or on the scalp, and then, of course, when you go out, it's quite noticeable.
So it certainly wasn't as disfiguring, in a sense, from the outside world as it could have been because of its location.
Exactly.
So now you're faced with a good portion of the body with this giant Nevi, or as sometimes they call it, a giant hairy Nevi. And there are a lot of decisions to be made here. First are the concerns that maybe something internally is going on. So what was done at that point?
Well, nevus is often associated with, a couple other conditions. The one that is the most worrisome is neurocutaneous syndrome, and they were less concerned about that with James because it wasn't on his back. If it's near the spine, there's more of a worry with this. But
and on the head.
And on the head, the spine, and especially the back of the head. But we did have an MRI done on James to rule it out, and thankfully he doesn't have it. But if there is a large nevus on the back or spine, there is often a large possibility that they may have neurocutaneous syndrome, which is, of course, very, very severe.
And he also didn't have seizures.
And he hadn't had seizures, right? No.
He hasn't had any seizures at all, so that was also a good marker that all he had was the nevus.
I think that's common with a lot of birthmarks, that when the appearance is more on the face or the spine or more midline, that one worries whether there's something internal or not. And then we often get an MRI to take a look at that. And we did that with James, and everything turned out perfectly. So
Thank God. Yes.
thankfully, that was not really the situation. So now we have a big cosmetic mess to deal with and try to figure out how to go about that. And there are multiple approaches, I believe you've learned in the process. How many physicians did you interview or talk about this with, different specialists with regard to treatment?
I believe with dermatologists we've seen at least 3 plastic surgeons. Is it 3 or 4?
3 pediatric plastic surgeons have evaluated James physically. A 4th did so via, with Wonder Technology,
That's right.
photographs.
Okay.
And we communicated with him in Chicago. And he's also seen now 4, I think, pediatric dermatologists.
Yeah.
As well, he has a specialized pediatric ophthalmologist. And even the man who we had read his MRI is specialized in reading
the MRIs of children with Nevis and trying to detect neurocutaneous syndrome. We ended up seeing a number of plastic surgeons precisely because this is such a rare condition. There are not a whole lot of surgeons who have a great deal of experience in Nevis removal, and that's the road we were taking, the Nevis removal. And so then there's also the decision between 2 different paths of removal. There's excision, and then there is something called skin expanders. And so far we've done just excision, but he may have to have skin expanders as well.
From the best of what you can tell from the specialist, what leads one more towards excision versus skin expanders?
I think the location and extent of the nevus. So there's some children who are born with the nevus maybe completely around their arm, like this sleeve. And in that sense, you cannot do an excision. You can't just cut and sew the skin. So you need to grow skin where there isn't the nevus to be able to pull over.
Right.
So location, but it also is a preference of some doctors. What we've learned, some of the plastic surgeons prefer to begin with the expanders. We were concerned, though, with the impact it would have on, whether it's necessary, but also the impact on internal organs when they're that young. So it was nice being able to visit so many different doctors and hear different approaches, but it also required us doing some research on our own.
To figure out which direction you wanted to go.
Right.
And I do think with any of these procedures that there's, when a doctor feels very comfortable with a certain one, it's really key that they stick with that, because that's the procedure that they have become most accustomed to. And whether you go one way with it or the other, the outcome could very likely be identical, but the person who's doing it is doing something that they have done over and over again and feel comfortable with, and that's key.
That was one of the biggest, if not the biggest, deciding factors in our choosing the surgeon we ultimately ended up choosing. He had an enormous number of before and after pictures, and they all looked very, very good. And I think I would definitely encourage anybody who has a child with this kind of condition or even related conditions that the before and after photos are very important to see. You want to know that they have a lot of experience.
And that's something we didn't realize at first until another parent with a child with Nevis gave us a list of questions that she recommended that we ask our plastic surgeons that we were interviewing, and we had to think of it as us interviewing them. And one of them was, could you please show us your portfolio? How many of these have you done? How many of these have you done in that location? And show us your portfolio. And to be honest, there was one plastic surgeon who refused to show us his portfolio, and that was a huge red flag. However, if we hadn't communicated with other parents, we wouldn't have felt empowered asking plastic surgeons and, in a way, expecting it of them. So with that one plastic surgeon, his refusal, we just thought, and he wanted to operate the following month. We moved on. We thought, this isn't who we want.
And thus far, we've had how many operations?
He's had 4.
4. And what was the process? They I'm assuming, took out small bits with each one?
Correct, yeah. It's a sort of serial excision. So with 4 excisions, with the first one, his nevus is in this area, they did a small area in the center to remove the area that was darkest, and that also had a number of sort of papular lesions that they were worried about at the time, and then they biopsied those to see if there were any problems. One of the other associated conditions, the strongly associated condition with nevus, can be, if it's left if it's not taken out, is skin cancer. And that's a very serious risk. So they checked the lesions, and there wasn't any in James's case, thank God. But they wanted to make sure they got those first.
And did they give you an idea of what kind of follow-up that they're going to expect down the road? Because skin cancer will always be a concern, and a skin check will always be a concern. Is this a yearly or every other year, every 6-month venture down the road? Have they given you an indication?
It's a yearly. He has a pediatric dermatologist, a specialist up in Northern California where his doctors are. They see him every year. They also have to take photographs of him so they can compare it year from year. We have been taught to be that much more vigilant in noting changes and also in providing him with protection with SPF whenever we go out, hats, things like that. We don't have to keep him in, but we just need to do what we're supposed to do what any parent is supposed to do.
And it's important to note that the incidence of skin cancer isn't dramatically higher just because of this lesion, but it is higher than the general population. And really anyone should be taking a look at their body and seeing what kind of lesions they have and see whether or not there's something that warrants the viewing of a dermatologist or the primary physician to see whether it needs excision. Do you have any concerns for your child as he gets older and with dealing with the whatever scarring and remaining birthmark there is?
We do.
I think we do. In two forms. We know that he will ask questions. And he already notices. He knows what he has. So we just talk to him about how brave he is, how incredible he is, how much he's already gone through beyond what most normal kids his age, well, other kids his age, or even adults experience. That's something he should be really proud of. We do realize that because of the satellite nevi and they can appear like bruises, we have to be very proactive whenever he starts a new school, he starts a new sporting program, to explain to the adults there and people in charge, this is what it is. This is, it doesn't spread, they're not bruises. And I think as long as we keep his community as well informed as possible and give him a sense of confidence that it may be a little different, but it shows how incredibly strong he is, then we hope that will give him the self-confidence he needs to go forward. Because there will be some scarring.
James is really fortunate to have had such vigilant parents in doing the research and finding the right physicians and making sure that the progress goes well. And I know that things are coming along well. He still has a course, but it should do really well. Thank you, Karina and Chris, for joining me in discussing your child's giant nevi. I am Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please visit us at drcareys.com. We're at Dr. Carey's We Teach Baby Care.
Breathe in, breathe out. Breathe in, breathe out. Okay. Let me see your